Good morning, good afternoon, or good evening, and welcome back to Bariatrics and Beyond, the podcast where we talk about life before, during, and beyond bariatric surgery. So grab yourself a healthy snack and a drink because on today's episode, we have my manager, sales manager, long-time plastic surgery coordinator, all the way from Kansas. We have Andrea Feeney, and the crowd goes wild. Andrea, you're coming to us from Kansas, but you're also coming to us inside your she shed.
Yes.
You're the only
Yep.
person I know that actually has a she shed. You hear about them, but I just thought they were urban legend. But this is proof.
Yes, I do.
Is it because you live on a farm, like in the middle of nowhere, and is it just like in your
Well,
backyard or?
I kind of live on a farm. I live on a lake, but we're in the back side of it. So it's trees and people are far away. So
And your she
I
shed's
have
just in the
chickens.
middle of your backyard.
Yeah, off to the side. And I have a pool. So it's got half cabana, half office.
Nice. Well, must be nice, Andrea. Okay, so let's get into it. For people who don't know you, can you introduce yourself and let us know a little about you and your role at EOC?
Yeah. So Andrea Feeney. Um, I live in Kansas, kind of out in the middle of nowhere. Uh, and I had weight loss surgery with before EOC back in 2015 and plastic surgery in 2017. And I actually started with the EOC, well, Dr. Ortiz, in 2017, I think, just helping out with the Facebook site. So that's kind of how I got started and met everybody. And then one of their plastic surgery coordinators had left. So I was helping them out with that until they found somebody else. And then after she left, I took over as Dr. Lazo's plastic surgery coordinator. And that's kind of how. So I'm OG.
Right, you kind of rolled into it, fell into it. So this is proof,
Yes.
you guys. We always get people asking like, "Are you guys hiring? Blah blah blah. How do I get a job at EOC?" And this is how it happens. Basically, just be present in that Facebook for support page, and then people become mediators, and then if you volunteer to be a mediator and a spot comes up, basically that's kind of how it really happens. Like we never
Right.
really put advertisements out to
Right.
hiring. So Andrea's a prime example of volunteering as a mediator to becoming a coordinator. And also you didn't mention Andrea, but then you also became our sales manager too.
Oh, yes. Sales. Yep.
So you oversee plastics and bariatrics.
Yep. Everybody.
Yeah. So you got your hands pretty full and you're juggling. And you also forgot to mention one other thing. You had facelift too.
Yes. Back in, well, I guess it's been 3 years now. So
Yeah. Because you're also Dr. Mendoza's
with
coordinator.
Dr. Mendoza.
Yeah.
Yes.
Yes, she undersells herself, this Andrea, I tell ya. Okay. So, but can you tell us about your background though? Like, where did you come from work-wise?
So I'm actually a respiratory therapist and I've been 28 years now.
Mhm.
Seems like a long time. My daughter just turned 29, so I have a son and a daughter. Uh, my son's 20, almost 21, and then my daughter just turned 29. Um, so yeah, I kind of did that, and I left that to when I started as a sales manager. Um, I was in the military, the Air Force, for 10 years. Um, and I built bombs as a munitions specialist. So little kind of departure from the what I was doing normally.
Right.
So I did that. And yeah,
I
I
love
guess
how
that's
versatile you are. Like, honestly, I've always
yeah.
said, when I grow up, I wanna be Andrea because, you're just so, and honestly, you always seem so unfazed. Like, you do you probably do stress. I mean, obviously we all do, but,
Yeah.
you do a really good job at just, holding it together though, you know?
I just don't sleep well.
You
I
sleep?
stress when I should be sleepy.
I didn't even know that you slept
But
because you guys, we've been on vacations together and Andrew's always the last one
yes.
awake and then the first one up. And I'm like, did you even go to bed? She's like, well, well. So, speaking of
All right.
vacations, What's the favorite part of your job? Because yeah, you've done a bunch of different things, so this is so different from
Eh,
what you're used to. What's your favorite part
right.
about EOC?
I do like, well, I like helping patients, obviously, because I've done that for 28 years.
Mm,
And this is a little different because instead of people being sick and, you're helping them get better,
mm,
this is, you're seeing people from beginning to end transformations. They lose the weight. And then now we're into the plastic surgery where they're getting to that final transformation, and just seeing those eh, faces
yeah.
when they're, happy, and
Yeah, so
it's
it's like still the medical
really
field,
nice.
but like
Yeah.
it's such the exciting part
Right.
of it
It's a
because
little
it's
different.
elective. It's
Yes.
almost like a victory, and it's like getting to like,
Right.
yeah, that makes sense. And
It's
then
the happier side of healthcare, I can.
right, yeah, 100% it is, but not
Yeah.
necessarily the easier side because like we'll talk about
No,
that.
no.
We'll talk about that in a bit. Um,
Yeah, later.
but what would you say is your most memorable moment of your career with EOC?
Mm, Memorable moment. Uh, I think there's probably a lot, but just seeing those patients that have lost, you know, tons of weight
Mm,
and have so much extra skin. And I mean, all our doctors are amazing.
mhm.
And it's been so long, and I still have days where I'm like, wow,
Damn, yeah,
that's really good.
yeah.
So just seeing, I think those are the good moments,
Mhm,
or the best moments, I think,
mhm.
seeing those patients that have tons of skin, and they come out looking amazing,
Yeah, like a
probably
different
better than I ever thought they could.
right, and so imagine how they feel at that point. It's like so much
Right.
better than they even expected. Um, and we're very lucky here at EOC because we go on a lot of trips, and we do a lot of work
Yes.
trips together. What one's been, do you think, your
Mhm.
favorite, work
Um,
trip together?
well, I like when we all get together, just, uh, because we are all spread out.
Yeah.
And so it's nice to see everybody and really kind of get together, and just because, I mean, we talk every day,
Mhm.
but you just don't get that, real personal connection. So those times that we can get together and everybody just have fun, you know,
Yeah, it's a good
those
time.
are
And
the
I'll
best.
see you next week because we're all got a New York trip next
Right.
week. So
Yes.
that's
Yes.
exciting. I want to say I reckon my favorite memory, like outside of work, but it was like work related, with you, Andrea, was the
Now,
you know what I'm gonna say, right?
for sure.
Was the night before our Christmas party in Tijuana. It was so fun. Do
Yeah.
you remember
I remember some of it, yes. And what I don't remember, there are pictures.
We've got evidence. You guys, we went to a club that was like just literally across the street from the Grand Hotel.
Right. Yeah.
And Andrew rallied, and it was just we just had such a good night at the club. There was bottles, and I think there's a point where Andrew doesn't remember the rest of the night. But the next morning, we had our Secret Santa gift exchange where we all had to like be in PJs, and Andrew, it was not that was probably your
No,
least
no,
favorite part
pretty good.
about it. Yeah, that was like she was in this like gift exchange, and she was just like, but that was fun. Like, I love that we get to also like, have fun and we see that side of each other, even though we all do work remotely. Like, I feel like we're just such a tight, like, really kind of like a family, that,
Right.
we get to do all that,
Oh,
that
yeah.
stuff. All right. So let's talk about plastics, right? Where, if someone's looking at having plastic surgery, where's a good place for them to start? Like, what do they need to know?
So a good place to start is the Facebook group.
Mm-hmm.
We have, I've put all the information in the featured side on that Facebook group. They're in different posts.
Mm-hmm.
Sometimes people can't find them, but it's all under usually my name. So that's kind of what you're looking for. And I try to kind of weed out stuff that's not pertinent to like getting started,
Mm-hmm.
or so that's what should be there. And I move the important kind of stuff to the beginning. So, priceless, uh, because that's a big, that's a big thing for people. Just how to get started. There's how to get a consult. Also in that Facebook group is albums page where you can look at different works from all the doctors. They each have a file in there. And then you can also search their names in the group, and because they post all their work also. So you can see that.
There's like
But
frequently
that's
asked
really a good
questions
place
in there
to start.
too. Yeah.
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 Yep. So that's a good place to start because, I know everybody assumes, okay, it's Mexico, so it's way cheaper. And it is for a lot of places. It just really depends on where you live. I'm in the Midwest, so it's not as big a difference as some places, but there are some places that, it's 3 times cheaper. So knowing that before you, kind of get into it, is a good place to start. And then just seeing the work, because that's really what you should be choosing where you go for plastic surgery, the surgeon's work. Price does, play a role in that, but really the work is what I would be looking for.
100%.
So
It's funny that you say that because I know somebody who was looking at doing some plastics in Mexico, and all the results are amazing. And every time she would inquire about them, she'd say, "Hey, like, what doctor did this?" And they wouldn't say what doctor it was. And then when she wanted to go get a consult, they basically told her, "Well, you just send us all your info, and then day of when you get here, when it's day of surgery, we'll tell you who your surgeon is, like, day of." I'm like, "That's
yeah,
wild.
no,
Who schedules surgery not
yeah,
even
no,
knowing who their surgeon is?" So in
right,
in
no, I wouldn't
saying
do that.
that, can you, if someone's just stumbling upon us for the first time right now, how many plastic surgeons does EOC have, and what do they do?
So we have a face surgeon. We had two. Dr. Mendoza is um, leaving us at the end of this year, so we'll have Dr. Espino. He does face work, and he's wonderful. And then we have Dr. Lazos, Dr. Rios, Dr. Ochoa, Dr. Nico. They all do body work, pretty much everything to do with the body from, you know, neck down, I guess.
Right.
And so they all do the body work. And
Right.
then we do also have, it's new to us, Dr. Herrera, and he does the lower region.
We like to call it the designer vagina.
Yeah,
Yeah.
that's right.
And so, yeah, literally
So,
EOC's got you covered
so we
from
go
head to
from
toe.
head to toe.
Yep,
Yes.
and
Yes.
everywhere in between.
Yeah, right.
So,
Right.
yeah, that's pretty awesome. Like, it's definitely a one-stop shop. So, Andrea, as a coordinator, how many coordinators are there for plastic surgery?
So for plastics, we have, myself and I have Dr. Lazos and Dr. Mendoza. And then we have Haley, who is taking care of Dr. Ochoa and Dr. Rios. We have Alyssa, who is doing Dr. Nico and Dr. Herrera. And then we have Nicole, who takes care of Dr. Espino.
Okay. So, what is basically like the relationship between the coordinator and the patient?
So the coordinator and the patient, we facilitate everything. Um, People are always asking, what's the difference between going through like a doctor's office or EOC? So we coordinate everything. We coordinate the hotel. Once you get to San Diego, so you get your flight to San Diego, and then from there on, we handle coordinating everything else, your appointments with the office, and the surgery times, all of that. We work with the office to help get all that information for you. We're there to answer any questions that you might have. We send out a lot of information, so it's really good for patients to read all that because there's really anything you need to know, I think, is probably in a lot of that information.
Yeah, it definitely
And
is. Yeah.
so,
Yeah.
yeah.
But
So
there's a lot of
if you read through
information. So I
that,
think some people just kind of skim over it, but it is so important to read it.
right?
It tells you everything from like
Yeah,
what medications you got to stop and what you got to
right.
do. Yeah. So it's really important.
Yeah. And then, if you have questions along the way, we get all your information and get it all put in the system. That way, once you get to Mexico, everybody has all that information. Um, so that's kind of what, we're for.
Yeah, and it doesn't just stop there. So I think with the bariatric coordinators, like a lot of their work is upfront, but I think
Right,
for the
right.
plastics coordinators, there's a lot of
Yes,
after the
because
patients have returned home, you're
right,
still in contact with them for,
right.
throughout the recovery and everything. So if a complication does occur, even just something so minor, if patients have questions, what do they do?
So we're also on the other end, we're the go-between for the surgeons.
Mm-hmm.
Obviously, they're too busy for everybody to contact them.
Mm-hmm.
So we get the information and we get it to the surgeon, and then they get us back um, their information to get to the patient.
Mm-hmm.
So anything that may come up, even, a small opening or just if somebody has questions. We get a lot of swelling questions,
Mm-hmm.
a lot of, you know, incision, how to take care of things. Um, you know, s- Small stuff uh, we have, like answers from the surgeon that we can give for basic stuff. But anything else, we just coordinate with the surgeon and
Mm-hmm.
get that information to them, and then they get it back to us. Obviously, we don't work 24/7.
Mm-hmm.
If there was something that you thought was an emergency, we were always going to recommend to go to like urgent care or to ER. Um, and you got to remember that we're doing stuff also over the computer. So, sometimes the picture doesn't do justice to what you have going on.
Mm-hmm.
And so, you always kind of just use your judgment. Um, there are a lot of things that seem scary,
Mm.
but they're not. I mean, and I understand that people, haven't done this before. So, I get that people get, anxious or
Mhm.
scared about something that's going on, but we've seen everything. Everything does heal,
Mhm.
even if it seems like it might not heal. If you have an opening, I've seen some that even I thought, wow, that it's going to take a while, but
Yeah.
everything heals up, and some, just take a little longer than others. But
Mm.
uh,
Be
so
patient. Just be patient, but if there's an
yes, yeah,
emergency, go to the yeah.
trust the process.
Yeah, that's the biggest thing with plastic surgery is trust the process, and it's a roller coaster. There's gonna be ups, there's gonna be
Oh
downs.
yes, it's in a very emotional
Yeah.
kind of surgery.
Which is crazy because you think it's, like, way more physical, and it is very physical, but, like,
Right. It's
I really think the
right.
emotional side of plastics, trump the physical side. Um,
Oh yes,
but
definitely.
so we love our Facebook group, our plastic surgery Facebook group. It's actually, it's pretty, it's getting pretty big now.
Yes.
We've got a lot. I think we've got over 70,000 members in there now, right?
Yeah.
Yeah. So that's pretty cool. Now we have a lot of, and I love the plastic surgery group, but we have a lot of bizarre and unhinged questions. So this segment we're gonna call bizarre and unhinged questions answered by Andrea. So I'm gonna run through some of the stuff I've seen on Facebook, okay? And you can like either
Gosh.
debunk them or tell me, just
Okay.
give us the real. Okay. Um, let's talk about a big topic is always belly buttons after surgery.
Oh yeah.
So can you tell us a couple things? I've seen people say that they put something in their belly button to size it. Is this a yay or a nay? And also, um, I've seen some people not even have a belly button.
Right.
So let's talk about
And
that.
that's a little more recent. People are opting not to have
Mhm.
a belly button.
Yeah.
They just feel like it really doesn't serve a purpose. It doesn't, just aesthetically, they feel like they just don't want it.
Yeah.
And it is, when you first see it, people are like, did they just forget your belly button? Or,
Right.
oh, no, they chose to do that. Um, uh, so, it's personal preference, but it's something that you can opt to not do. Um, I know some people said that they'd had issues with their belly button, um, and they just didn't want to have that anymore. So, they just opted not to do it. So that is personal preference.
Yeah, but every tummy tuck
You
does
can,
come with the belly button, unless you say
yes, yeah.
otherwise.
They always put it back and they're not removing it
Yeah.
completely. It's a stock that it actually connects like clear up, it's a whole long process, but it's just on a stock. So
Right.
they don't remove it completely.
Yeah.
They just
Don't cut the new hole, right?
disconnect it, right?
Yeah.
And then once they pull all your skin down, they make a new hole for your belly button. So it's your belly button.
Mm-hmm.
They're just reconnecting it. So
Repositioning the hole.
right.
Yeah.
And
Is it just me, or does anyone's like belly button tingle when you think about that? Like it just gives me the
well,
icks.
so there's a science guy that I have on Facebook, and he does all these weird questions. And he was saying that it is connected down to an area like another region.
Mm-hmm.
And that's why, like, when you poke your belly button, you can kind of feel it
Yeah.
down, and so that is why.
So interesting. And now
I didn't know that before that.
yeah, right? But I mean, it kind of makes sense when you think about it and the umbilical cord and all that. Anyhow, we're
Right.
derailing.
Yeah.
Tell us about belly button sizes. Do you recommend putting anything
Okay,
in your belly
so
button?
you shouldn't be using anything anywhere that your surgeon doesn't tell you to use.
Mm-hmm.
Just state that right now. You're going to hear all kinds of stuff. Um, you know, Facebook, other people that had surgery, other places. Um, you can hear things everywhere, and different surgeons have different rules. But the good rule of thumb is to never use anything that your surgeon does not tell you to use, right?
Mm-hmm.
Some people, if they're having the belly button can contract up a little bit, and everybody heals differently. It's not anything that the surgeon did, or it's just how you're healing. So, as you heal, sometimes those incision lines may kind of just contract a little more.
Mm-hmm.
And so they may recommend that, there are sizers. They're not really sizers, it's kind of like spacers, but it kind of holds your belly button open. Um, and so if that was something, you just get it on like Amazon, uh, that they might recommend that you use to kind of hold that open just a little bit. It's not like you're making the belly button different. You're
Mm-hmm.
just keeping it from contracting.
Right. Okay.
But
Makes sense. Yeah.
Mhm.
Now we're going to talk about the butt. I've got a couple of butt
Yes.
questions. So the first one is, people often say that their butt crack is longer now. Is this true or
Well,
false?
if you're getting the belt, if you think about it, that is pulling up a little bit. So it's going to look different on everybody. It may seem longer,
Mm-hmm.
but it just all depends on the patient, and that's something that the surgeon, in your pre-op appointment, you could discuss with the surgeon. Um, but but you it just depends on what the procedure you're having done. So
Right. I've been seeing lately a lot of the backside of the belt have been going kind of more in a V. I
uh
would think that would maybe
yes.
help with like not having the butt crack so
Yeah,
higher up. I
and
don't
it
know.
really depends. I mean, I usually when they're doing the surgeries, they're really following kind of the shape of your body.
Mm,
So, with everything that they do, I think your body makes a big difference.
yeah.
And so they're going to try and do, because obviously nobody wants to see incision lines. So they're going to do what they can to try and hide those.
Mhm.
Um, and it's just going to follow, the curve of your body. But yes, sometimes it's almost like a top of a heart.
Mm.
Um,
Yeah.
shape that goes down, but I think it really depends on the patient also. And
Mm. Yeah.
mm,
I like that. Now, talking about butts, BBLs. This is all over the internet right now. I know it's made it into our Facebook page. You know what I'm going to say, Andrea.
yeah,
Do BBLs smell?
there is no scientific reason that somebody that has a BBL should smell. I mean, the BBL itself should not smell. You're taking your fat and relocating it to the butt area. There's, just no reason. Maybe if you got a big butt
Mm.
and it's something different for you and you're not eating it as well or something. That's the only reason really that the surgeons or anybody could really come up with it would be why it would smell. But the BBL itself, there's no scientific reason that it would smell.
Right. So,
So
girls, if you're cheeked up
I don't know what.
and it's summer and it's sweaty, you got to
Right.
you got to
Get
keep it
under
clean in there.
those
Yeah, you got to
cracks.
just
Right.
spread them and just make sure
Yeah.
you
Get
you
on in
clean.
there.
Yeah, just get in there.
Yeah, you might have a new fold or something that you didn't have before
Yeah.
that's, so.
Yeah, and that's that's valid. Um, Now let's talk about the boppy pillow after a BBL. Right. So how long
So,
do you have to sit on that and all that stuff?
uh, so you should be using that for, a month,
Mhm.
and you it should be anytime you're sitting, you should be, sitting on that.
Mhm.
The whole idea of the boppy pillow is to take that pressure off the butt area, the fat absorption is lessened. So you don't want any pressure on that area that's would make it uneven or anything like that. So the
Mhm.
boppy pillow is really to kind of put more pressure on your thighs to kind of sit you up more. You're not sitting inside a hole.
Yeah.
You want it, overcrossing in the back. And so you're going to have that larger area of the boppy more on your thighs. And it kind
Mhm.
of just helps you sit up a little more off of that butt area. So you're not, sitting back on that.
Putting all the pressure, yeah. Because like a lot of people that just get BBLs,
Mhm.
they have to lay flat on their stomach, but most of our
Right.
combos have
Yeah. When you're
boobs and all that. So there's
right.
that this is like the best way we kind of figured they
Right.
kind of figured how to.
Well, and you're
Mm.
never gonna get away from completely. I mean, you think of sleeping, there's a lot of, uh, people have had a lot of good ideas, they get a lot of pillows in
Mm.
there and to kinda keep it off that area, you just kinda gotta work around it and
Mhm.
think about how you're sitting or laying and where that pressure is at for that.
Right. Because
Um,
how much of a BBL dissolves?
they say with any of that fat grafting, they say up to 30%.
Mm.
But of course, like it with anything, that's different for every patient.
Mhm.
And it depends on how you take care of it also uh, with any of that. So, and, some people might be more, might be less.
Mm.
And you always got to remember, because right at the beginning, your butt is going to be a lot bigger than it
Mhm.
actually really is. With swelling. I mean, I remember when I got breast done, I mean, my boobs were huge. I
Really?
remember calling my husband and I took him a picture and he's like, "Oh God."
He's like,
But
"All
they were
right."
big. But that was a lot of that was swelling.
Mm.
So, when you, eh, right after surgery, you're going to have some swelling. We had a friend, well, she actually is one of our assistants. She had a BBL and, we kind of made fun of her. We called her Big Booty Judy because at the very beginning, it did look
Yeah.
really big.
She was
But a
so
lot of that,
panicked too.
yes,
I love her. I love
she
her
was worried
booty.
about it.
That's like
Yes.
she's
So
goals for me.
yeah, once that swelling goes down, and I think people think that right after surgery, that is their butt.
Mm.
And then once the swelling goes down, they think they're losing their that
The
BBL, but
BBL.
you're really not. You're losing the
This
swelling
mhm.
at first. And so when there's a change at first, more of that's probably related to swelling than the actual losing fat.
Right. Yeah, that makes complete sense. So
Yeah.
how do people choose like the size of their BBL? Is it up to them or
Um. Uh. y- Well, it's yes and no.
mm.
Um. Somebody might want a huge butt, and I know when some, people are like, "Oh, I don't want that. I don't want that,"
Mm.
and I always got to tell them it's not always about size. You don't have to get the Kardashian butt, it doesn't have to be huge. A lot of times, especially if you're getting the belt, they're pulling up that skin and it can flatten out the butt a little bit when they pull that skin up. And so the BBL can just be for shape, just a little extra shape to kind of offset like the belt or something like that.
Yeah, like even you out, you might have like dips and stuff like that. So
Right.
yeah,
Yeah.
it's not necessarily like
So
because men get
right.
BBLs too,
It's
and
not
they
always about
yeah.
It's not always about like getting that huge butt. Now, when we think about the huge butt, we do have people that are like, oh, I want that. I want, that huge booty, as
Gu-
big as it can get.
Guilty. I
And
wanted a huge one.
so the problem with that is not everybody can get that.
Mm,
It really depends on your body. A lot of those butts that you see uh probably are I guess fake.
implants.
Like the or like on the TV or picture,
Or
they're
like photoshopped.
manipulated. Yes,
Oh yeah,
Photoshop.
yeah. You see that
And
all the
so
time.
yeah, you can't always take that for, oh, I love this butt. Well, that
hmm
butt probably is not real.
That butt doesn't even look like
Um,
that butt in real
yeah,
life.
you have
Yeah.
to have kind of a natural shape to
hmm
get like the huge like butts. When
hmm
you're thinking like Latino,
hmm
that kind of where
Projection. Mm.
naturally, yes, genetics plays a lot of
hmm
that. So, but there are people, that, and you got to have enough fat.
Mm.
So, you got to have the fat to harvest to
Mm.
get that, but so it really, there's quite a few things that go into that. And they'll try and do what you want. If you want the biggest butt possible, they're going to try and do that for you.
Mm. But
Now,
they can only work
whether
with what
that's
you
going to
give them.
be, that's right.
Yeah.
They're not miracle workers.
hmm
They are
Yeah.
magicians,
Yeah.
but they're not miracle workers. So they're going to try and, because I mean, their goal is to make you happy.
hmm
They want you to have the results you want.
hmm
And so they're going to do what they can safely do and within what your body will allow.
Yep.
That makes sense.
Yeah,
So,
absolutely. So let's say you want the huge badunka-dunk, but you don't have the junka-junk to supply. Do we do butt
yeah,
implants?
no, we do not.
Okay. And why is that?
I think the risk of infection, the risk. Oh, I saw a botched episode. I think with a girl that had implants, and they were just kind of out there,
Mm,
like you can
mhm.
see, like the implant. So I think just the infection and risk of outcomes, and they just don't mess
Right.
with them.
That makes sense. Okay, now we're
Yeah.
gonna move on to the Fahas. It is also related to the
Oh
butt.
yes.
How do you A, wee, and B, poop in a Faha? Do you have to take it off?
No, you do not have to take the
Okay.
fob off. If you've never worn one or seen one, there is an opening down in the nether region, and it it is a pretty big opening. It goes to front to back, so it covers going pee, going poop. Now the key to that is really you kind of got to pull it apart. Be prepared and get that. Make sure it's kind of pulled apart enough that you aren't going to get anything on it. So,
Yeah, I mean,
but
if you have a Faha before surgery, it might be worth just practicing. And also,
yeah,
I
right.
recommend a Shiwi as well, like, because I've done my legs and it's kind of harder to like bend up and down. So also like a
Right. So if
Shiwi.
you, especially with the thighs,
Mm,
um, a lot of people like them. Some people, didn't use them. So it's really kind of a camping thing.
hmm
Something that you can actually turn yourself into like a guy pee, really.
Right. They're
It's
so
kind of like a
lucky.
funnel. Yeah.
Yeah.
It's kind of like a funnel that you just put up there, hold up there, and then kind of the pee comes out and goes into the toilet. So if you have, especially with thighs, but even with like the tummy tucks, you do, like you had a million sit-ups and, went to the gym and, that day after you first go back to the gym and your legs are like trembling or
Yes.
something. So,
Yeah.
it can help with that, but
They do come in handy. How long do you have to wear a faja for? And when do you start wearing the faja?
So you should be wearing the faja, the stage 1 faja for 2 months. Um, Everybody always talks about like the stage 2. That is more of an all over compression, like for more like Spanx type. And if you want to continue to wear that after the 2 months, you could always get a stage 2 faja. You can stay in the stage 1 faja. Some people, prefer to stay in that. And, but you should be in the stage 1 for the 2 months because that's the post-surgical, that more focuses on the swelling and the compression for the swelling. Once you get to stage 2, you're looking more for shape.
Yeah.
So,
like you've recovered from the surgery side of things. Now it's like,
right.
let's get snatched.
And now you're kind of shaping things.
Yeah.
And some people, like those and some people don't. You don't have to get it. It's up to you, but it is, that 2 months, post-op is
minimum
what they recommend that you're wearing that stage 1 faja.
Okay, cool. Now let's move on to the boobs because we have a lot of few boob questions. Now with a breast lift, right? The areolas, they get removed. Do they get resized, reshaped? Like what happens there?
So it's still kind of like the belly button. So they have to. So a lift is a reduction. So when we say lift, we're really talking also a reduction, because you have to remove tissue to be able to lift the breasts up. I mean, you can't just pull them up without removing some tissue.
Yeah.
Yeah. So they normally will go around the areola and then down, and they kind of remove. It's almost like a little star shape. So they got, they're removing tissue from higher, and then you want to bring that nipple up. So, it does. You can resize it. You just need to talk to them at your pre-op. They do have their like little cookie cutters.
Right.
So they can, do the shape. If somebody wanted something small, obviously making it bigger would not work. But if you wanted to make it smaller, that is something that you could talk to them about and they could try and do when they reattach everything.
Yeah. And they won't do love heart-shaped ones because I asked, just in case anyone's I had one of those unhinged questions like, can you make it into a love heart? He's just like, go away. I'm like, damn it. It was worth a try. Now let's talk about nipple piercings. If you have had them done, obviously you've got to take them out. Can you put them back in? And then after surgery, how long after can you get them done if you want them done?
So really, like tattoos, piercings, you're really wanting to wait like a year, because that's kind of when they say 6 months to a year is like true healing, for like the plastic stuff, and so you kind of want to be healed, and you want everything healed before you do any of that, and we're talking like tattoos on incisions, not just
regular.
anywhere else. But yeah, I mean, people get them re-pierced and, issues. I did see something the other day it was almost like kind of like a horseshoe that went over the nipple, but it would look like a piercing.
Oh, like a fake one, like a clamp on type.
Yeah.
But yes.
And I was like, that would be handy because you could take it out and put it back on if you wanted, but I suppose you'd have the right nipple for that. But
so one of our coordinators, I'm not going to name names, she had hers done before surgery and then she took it out obviously for surgery. And then when she was like, oh, let me see if I can get it back in, instead of it going that way, her new it was like that way, which is interesting.
Yeah, so you can't put it back in the same hole.
Yeah.
Because it might not be he's not looking at that when he puts it back in there. He's just putting the nipple, back on there. So, her hole was completely, so she had to do a new hole. So.
Yeah, that's funny.
That was not working.
Also, like, let's talk about implant size. What's the biggest implant size EOC will do?
So, it really depends on. So when they're doing implants, there's a couple things they look at. They do measure your chest. They have specific measurements that they do for implants. So, uh, you can only go so small and only go so big. What I can do and what you can do are,
Two
two
different
different
sizes.
things.
Yeah.
So, because your friend got 800 implants doesn't mean you can get 800 implants. And if you did get 800 implants, doesn't mean they're going to look the same.
Yeah.
Like, it really depends on how much tissue you have, your pocket that they're going to be putting it in. So once you get over 540, those have to be ordered. And so you kind of got to know what you're, wanting. Usually if somebody's getting something that large, they've already had implants and they're sizing up. They already know, okay, I've got 600s and I want 800s. I'm trying to think. I think the biggest one I've had is like an 850.
Yeah.
And those were pretty big.
Yeah.
So, but it's going to look big, different on everyone. Cause I mean, my boobs are pretty big, but I only have 270s.
That's crazy to me that you have 270s. Yeah.
And I
Are you sure?
really thought they were larger. Yes, because I found my implant card the other day.
Oh, wow.
And I was like, really 270s.
Damn.
I knew it wasn't huge. I thought it was, like 350, 375 or something. But these people get 500s, 600s, and I'm like, wow, like she's pretty
Right.
small.
I guess it all depends on like how much breast tissue you still have anyways.
Right.
Because if you've got a fair bit of breast tissue and you add in a 270, then that's going to look a lot bigger than someone who's got no breast tissue add in a 370.
Right.
You know what I mean? So that's why it's like,
So
you can't compare.
if if you're smaller and you have, really no fat, and that's going to look different also because you're just going to see the implant. So they do look different, and they're going to give you their recommendation. They're going to measure you. They're going to give you your recommendations, and then or some options. And then, you kind of got to make that decision what, based off what your goals are.
Right.
But there are limitations. So you can't go in there and say, I want 800s and expect to get those when you've never, especially if you're doing a lift. But, different people are different. And once they measure you and they can kind of see, and skin quality makes a difference also when we're talking about lifts. Because, the bigger the implant you get, the saggier.
Yeah.
Yes. I mean, that is going to sag. If you're doing a lift, that skin is already stretched out. And so, they've cut some of that away. And now, if you're adding an implant to that, then, you're just increasing. The heavier it is, the bigger chance of your breast sagging. And also, some people can't get implants when they're doing a lift. If you've had very saggy breasts, a lot of tissue, when they do a lift, putting an implant in there also can really increase your chance of nipple necrosis. And so necrosis, for anybody that doesn't know, is tissue death, basically. And so when we're talking about necrosis, that's when you put that implant in, it's pushing against that nipple, and that nipple that's newly healing, and it could be cutting off blood flow. So there are some times when they say, you can't get an implant. You can always go back once it's healed and then get an implant put in. That's an option too for some people, but there are limitations. But I think the biggest implant I've seen is maybe 850. I know there are like 1,000.
Mm-hmm.
But those are pretty big, and not
Yeah.
everybody, not a lot of people could do an implant like that. So,
Right. And what about does EOC go over or under the muscle?
usually, so if you're not doing a lift, I think it's really up to you. Um, if you don't have a lot of breast tissue and say you're just getting, you just want implants, and you can go under the muscle
Mm-hmm.
or over the muscle, I believe. Probably your option. If you're getting a lift, normally they're going to go over the muscle.
Okay.
And the reason they do that is when you're going under the muscle, those are kind of, they're held there by the muscle and they're a little bit higher. Um, so when you've already had a lift and your tissue has sagged, you run the risk of what they call developing Snoopy nose or
Mm-hmm.
the waterfall effect. And that's when you have your implant and then the breast is kind of sagging down underneath that.
Mm-hmm.
And so it, or double bubble, I heard them call it too.
Oh, yeah.
And so, yeah,
That
so
makes
they
sense.
normally don't do under the muscle. If you've already had under the muscle
Mm-hmm.
and they're replacing that, sometimes they can do that.
Mm-hmm.
But you just got to talk to the surgeon about it.
Gotcha. Because yeah, it makes sense. Like if you do it over the muscle, eventually over time, gravity just happens. So
Right.
the implant will move with your breast tissue versus if it's under the muscle,
Right.
implant stays and your breast
Right.
tissue moves. So
Yes.
that makes sense.
Yes.
Okay, now two more questions and then we're going to let you go. But we also, yeah, you're almost there, Andrea. Andrea was dreading this, by the way, you
Oh my
guys.
gosh.
She's like, I don't want to be on camera. I think I've
Well,
asked you
and I
every
was supposed to
week.
do it last week
I
and
know.
messed it up. It
Well,
was
but then
horrible.
the week before, I was like, oh my God, we had so this is
Oh,
like the
yes.
third time lucky. So we're so glad she's here. And I did ask you, like when we first started this podcast, you're like, nah,
Yeah.
nah, nah,
No,
nah.
I
And
do
it's
somebody else.
been almost a year. Now. Actually, yeah, we're coming up on a year on this podcast. I'm like, Andrew, it's time. but
Yeah.
but okay, so I'm gonna let you go. But let's talk about the FUPA. I think a lot of people think FUPA, they think it's a
Uh,
belly. FUPA is not the belly. Can you
no,
explain what it is and
no.
does that
So,
get reduced during a tummy tuck?
well, okay. So, yes, they can lipo that area. So we're talking the, I guess the vaginal pooch, I
Yeah,
guess you'd call it,
the way
that
I
the
think of
fat pad on
yeah,
the top of the vagina.
yeah, so if you go
That's your fupa.
yeah, the fat above the pubic area is a FUPA.
Yes, there you go.
There you go.
When they're doing the tummy tuck, if that's a concern for you already, you can talk to them about it and they can usually lipo that area. Now, it does naturally get pulled up
Mhm,
with the tummy tuck. So they're pulling down and they're pulling up.
mhm,
And so it does get pulled up. So if that's a concern for you, definitely talk to them about it, and make sure that they know, that that is a concern for you and see what they say about what they can do for that. But it's included if you're getting a tummy tuck. If you're coming back for, say, like arms and thighs and that area is a concern for you, um, it is something that they could do, extra with those procedures or
mhm.
something. So, yeah.
Gotcha. Now that we're in the nether regions, let's talk about sexy time. How long after plastics is it safe to do the deed, and does it feel different because things get moved around?
Yeah. So 6 to 8 weeks, you're going to want to wait. And I know there have been people, and I'm going to tell you, I have had a patient have an opening
Mm,
because they had sex.
mm.
So, you're spending this money. It's really not worth, figure something else out. Take the time to heal.
Yeah.
Um, and, just wait
Mm,
because they're doing a lot of stuff. If you're getting a full mommy makeover, you're getting your muscles, usually the muscle repair that comes with all the tummy tucks if you need it. I got something in my eye. They're doing that. So, you have that underneath and then all your incisions and, even 3-4 weeks out,
mhm.
you're thinking, oh, I feel good, you know, just don't do it.
Right.
Wait the time, figure something else out.
Yep.
Um, and that's less active.
Mm.
And and as far as I think, yes, it probably does feel different because once again, on that area, you are pulling that up. And so everything that is down there kind of goes up
It's
with it a little bit.
yeah.
And so, guys, uh, they say, it's not making your penis bigger and, all that, but you can, um, it is getting pulled up also.
Mm.
So,
You probably
uh,
see it more now.
well, right. So, that area that, where those sensations happen, are getting moved
Yeah.
and it is going to feel different. And, pretty much from what I can tell, it's all a positive.
That's good. That's good. And also remember you got your muscle repair too. So that's,
Right.
there's a lot of core
Yes,
muscles that go into all that
that's right.
that comes with all that. Okay. Well, Andrea, I
Yes.
think you answered every question we had. So thank you so much
I
for
have one more
you do?
if you want to cover it. Yes. I was going to make a post, but one question that people do ask, I think, with plastic surgery, when you're talking about like it is a very emotional surgery.
Mm-hmm.
And people are always asking, do I need a companion?
Mm,
Um, can I go alone? Uh, it really depends. We don't know you.
mm.
We know from talking with you, and
Your
so we
health
can't
history,
say,
your questionnaire, but that's about
yeah,
it.
I
Yeah.
mean, we know
Yeah.
the basics, but that doesn't tell us,
Mm.
how well you handle
Stress.
being
Yeah.
uncomfortable,
Mm-hmm.
how well you handle stress, how well you handle being in another country,
Yeah.
traveling.
Mm-hmm.
There's a lot of stuff that's going on with this surgery. A lot of times people, this is the first time they've been out of the country, so really you need to know you.
Mm-hmm.
So if you're a person that handles stress well, is laid back, um, not that there's so with plastic surgery, everybody thinks, oh, it's so painful. It's going to be so painful, and it's really not.
Mm.
It's really more pressure from swelling. Some people, and everybody has a different pain tolerance.
Mm-hmm.
So, really, how you deal with those situations on a normal basis.
Mm.
So, you know, and you. So if you know that you don't deal well with those situations, or you're always with people, you don't, you know, do things on your own
Yeah.
normally, then it's probably a good idea to bring a companion. This is
Mm.
not the time to decide, hey, I think I'll do something by myself.
Right. Yeah.
you
This is
know,
not, yeah.
I mean, this is not the time to be
Yeah.
experimenting. So
And bring
if you don't normally,
right. And a
go
companion that
ahead.
you know and you trust, not just someone that's like
Right.
you've never
Yes.
traveled with before, you've never spent long periods of
Right.
time. No, you need someone that knows
Yes.
all of you and you've spent a
That's right.
lot of time with them already. Yeah.
Yes.
Not a first time
Yeah, this
traveling
isn't the
together
time
thing. Yeah.
to pick somebody new and say,
Yeah.
"Hey, for somebody from work, do you wanna
Mm.
go with
Yeah,
me?"
exactly.
I mean, you might get along at work, but that doesn't
Mm.
mean you're gonna get along, and you're in a situation where half the time you're naked.
Yeah, you're
There's a
vulnerable.
lot
Yeah.
of nudity,
Mm-hmm.
and, yeah, it is a very vulnerable,
Yeah.
position to be in.
Mm.
So you want somebody you're gonna feel comfortable with.
Mm-hmm.
You want somebody that's not overbearing,
Mm-hmm.
um, not, uh there are people that just kind of take over the situation. You want somebody that's going to be there for you.
Mm.
When people start asking me, oh, what can they do? I want to make sure they, uh, they're there for you.
Mm.
That's the whole idea of the
Mm-hmm.
companion.
Mm-hmm.
So I'm not saying they couldn't go out and do stuff while you're sleeping or anything, but the whole goal is that they're there to help you,
Mm.
and but you can do it alone
Yeah.
perfectly well. I mean, I've never taken anybody, but I'm a
You're a lone wolf.
I go to Ireland by myself,
Yeah.
drive on the wrong side of the road that I've never
Yeah.
done, and
Yeah.
wing it type
Yeah.
of person. So, um, but I'm telling you, even day 3,
Mm.
I was crying in my bathroom.
What? Andrea cries?
I
No way.
I know. No, I had an emotional breakdown, and that poor nurse that came in there, and he was so sweet. He
Oh,
was like, "Oh, honey, it's gonna be okay." And I'm like, "I know," but it
just
was just
I need a moment.
yeah, I
Yeah.
mean,
Yeah.
it like caught up with me, and
Mm,
so and I'm a real laid back,
mm,
handle things well type person. So,
mhm,
it is a very emotional time. And so you just want to make sure that you're doing yourself justice by
mm.
bringing somebody, if you really think you need somebody.
Yeah, that's a
So,
good point, Andrea.
yeah,
Good point.
but
Perfect. Yeah.
I
So
think that's about
that's
it. And
it.
just be patient.
Yeah,
Yeah, I think
I agree.
the main things with plastics is you kind of got to go with the flow.
Mhm.
You are on Mexico time. Um, so things aren't exactly, they might say 8 o'clock and it ends up being 8:15 or
Mm,
8:20.
mm,
So you kind of just gotta go with the flow and just be patient with the process, because even after you get back and you're healing,
mhm,
it is a process, and you just gotta kind of trust that. Swelling is a big thing for people.
mhm.
They uh, all the time we'll get pictures and they're like, "Oh, this looks horrible," but
Yeah.
okay, you're still swollen,
Yeah, I'm
you
3
know.
weeks post-op and my tummy isn't flat yet, and it's like,
Right.
well.
Yes.
Yeah.
Yeah.
Mm,
And you got to remember, sometimes when you're seeing somebody's picture, well, they're already healed,
exactly.
and
Yep,
so it's not an immediate thing all the time.
yep.
So and even like your 5-day post-op pictures, you might look great and everything's tight, and then you get home and all of a
Mhm,
sudden things aren't so tight.
mhm.
Well, no, nothing's ruined.
Yeah.
It's just that, now things are kind of moving around and changing and the swelling's changing.
Mhm,
And so you just want to be patient
mhm.
and just kind of trust the process. If
Yeah.
you have small openings, everything heals.
Mhm.
And so just you just got to be patient, really.
Be patient, take it easy, and trust the process. That's
That's right.
basically in a
Follow the
nutshell.
rules.
That's it, that's it. Don't go having sexy time 3 weeks post-op.
That's right. Don't be vacuuming.
Yeah, nothing like that. Just be a person of leisure for the first 8 weeks.
Well, and it is hard because you're not sick.
Yeah,
The thing with like this surgery is you're not sick.
yeah.
So once you get past the first 2 weeks,
Mm,
you're starting to feel better, but you still should not be doing anything.
yeah, because that's
And
when it will
so
like,
that's
an opening will happen.
right.
Yeah.
Like week 3 and 4 is
Mhm.
the time that is important for people, because I think that's when people start getting confident.
Exactly.
They're like, "Oh, I didn't have any openings, and
Mhm.
I no problems."
Mhm.
And boom,
Yep.
you go
Yep.
running down the street to catch your dog or something, and
Yeah.
now you've got an opening.
Yep.
So really, 3 to 4 weeks is really, I think, an important time for people to realize that yes,
You
you may
feel
not have
good.
any
Mhm.
openings and you're feeling good, you're looking good. Don't get too confident.
Yeah, don't get ahead of the game. Well, that makes
Right.
sense. Well, Andrea, thank you so much for
Yeah.
joining us. It wasn't that
Yes.
painful, and you did amazing. And you do such a good job, like in the Facebook group and everything, just keeping everybody informed. And
Oh, I try.
yeah, you do really good. So we love you, and I'll see you next week, Andrea, in real
All
life.
right.
All right, see you in New
Okay.
York. All right, you
Bye.
guys. Thank you for joining into Bariatrics and Beyond, and I'll see you guys same time, same place next week as well. Bye.